Did you know that your practice is probably losing about 14 patients every single month? According to Dentrix, the average yearly attrition for a well-established dental practice is around 10 to 15%. And for newer practices, that number jumps to around 15 to 20%. Henry Schein reports that the industry average is around 17% according to their data. So what this means is if you start the year with 1,000 active patients, for example, by the time next year rolls around, only 830 of them will still be with you. That's 14 patients lost every single month, and a lot of these losses are actually preventable. In this video, we're going to cover the main reasons why patients leave and how to address them, the simple systems that the top performing practices use to retain those patients, how to ensure your staff is accountable and actually delivering the best patient experience, and make sure you stick around till the end because I'll share with you some bonus resources that can really help your team deliver the amazing customer service that are going to keep patients coming back for life. While the average practice attrition in most dental offices is high, when you look at the top 10% of practices, the ones that truly invest in patient experience and customer service, they only see an average of 4 to 8% attrition per year. That's a pretty big difference, and reducing your attrition can completely change the future of your practice. So picture this, you've got two dental practices, practice A and practice B, and they both start the year with 1,000 active patients. They both spend the same amount of money on marketing, and they each bring in 30 new patients a month. Now, practice A is your average dental practice. They're doing all the usual things. Their patient attrition rate is 17%, which according to Henry Schein's data is what the average practice experiences. But then on the other hand, you've got practice B, and they're laser focused on the entire patient journey. They make sure that every single interaction with their patients, it feels personal. They're proactively trying to address issues that could cause a patient to leave. So let's say as a result of that, their annual attrition rate is only 8%. So fast forward 10 years.
10 years later.
Practice A ends up with 1,640 active patients, while Practice B grows to 2,776 active patients. They both spend the same amount of money on marketing, they're both doing the same thing, but one of the practices ends up with 1,100 extra patients. So what does it take to be more like Practice B, to lower your attrition and keep the patients that you worked so hard and you spend so much money to attract? How do you actually keep these people loyal and coming back to your practice? Well, let's take a look at why patients decide to leave. Most dentists assume that it's because people move or they pass away. They think that patient attrition is unavoidable. But let's look at the actual data. So in the US, about 0.8% of the population dies each year. And when it comes to moving, according to a 2024 moving report, roughly 7.8% of people in the US move annually. But here's the kicker. Of the ones that move, over 60% of them stay within a 6-mile radius of their previous home. So in reality, only around 3 to 4% of the total population moves far enough away to make it impractical to continue coming to your practice. However, the average dental practice sees an attrition rate of 17%. That's a huge gap, which tells us that most patients aren't leaving because of life circumstances. They're leaving for other reasons. So what are they? One reason could be insurance changes. Maybe your practice dropped a PPO plan that some patients relied on, and they chose to find a new dentist that still accepts their coverage. That's completely understandable. But this alone doesn't explain persistently high attrition. Because think about it, when you drop an insurance plan, then yes, you'll see a spike in attrition initially. But once those insurance-driven patients leave, your numbers should stabilize. If your attrition rate stays high year after year, then obviously something else is going on. At RevUp Dental, our software has analyzed over 1 million dental phone calls to uncover what truly sets the high-performance practices apart, the ones that grow to 3, 4, 5 times the size of your average dental office. And one of the biggest reasons patients leave, there's no follow-up, there's no accountability, there's just no system in place, and therefore people keep slipping through the cracks. Just think about it. How many people call to cancel their appointment every month at your practice? Do you even know? How are you even tracking this? And more importantly, is your staff actually trying to rebook these appointments? And how are you verifying that this is actually happening? Because I'll tell you what we see time and again. We ask the dentist, hey, if someone calls to cancel an appointment, does your team try to find out why? And do they put in an effort to try to rebook that patient? And of course, the dentist says, yeah, absolutely. But most are not actually checking if that's true. They just assume it is. And then we come in, we analyze every call and patient interaction that they get, and we find something that's quite shocking, but sadly very common. In over 70 to 80% of cases, the staff don't ask the patient if they want to reschedule. A patient calls up and says,
"Hey, it's John calling. I'm really sorry, but I can't make that appointment on Wednesday."
Okay, no problem, John. I'll cancel that for you. Bye-bye.
And that's it. No asking why, no effort to rebook, no follow-up, no system, just, okay, no problem, bye. So we sit down with the dentist and their staff and we play call recording after call recording of this happening every single week. Dozens and dozens of patients every single month who call to cancel, and the staff put in zero effort into figuring out why and zero effort into trying to get them back on the schedule. And the dentist is sitting there in complete shock. But what do you expect? This is what happens when you don't have a system of accountability in your practice. When you don't have any visibility into what's actually going on at your front desk, then things inevitably fall through the cracks. And your patient base slowly erodes. Most of the time, you don't even notice this happening. Another common reason why patients leave is bad customer service. Just because you, the dentist, the business owner, value the patients and treat them with respect, doesn't mean that your staff is doing the same thing. It's important to remember, as a dentist, you are not the first or the last person a patient interacts with. There's a lot that can go wrong long before they ever sit in your chair. And there's a lot that can go wrong after you've provided them dental care. Most patients' experience is shaped by your team, the people answering the phones, handling appointments, follow-ups, and managing the day-to-day communication. And if you don't have the right people with the right training, the right systems, and the right attitude in place, then they could be quietly driving patients away without you ever realizing it. So let me give you a real example. Have a listen to this voicemail.
Sorry we missed your call. If you could leave us a message with your name, number, and reason for calling, we will get back to you as soon as we can.
Hi, this is. It's my third time calling. I hope someone can call me back at. I'd like to make an appointment for my father. Thank you. Bye-bye.
So this was the daughter of an elderly patient who had been trying for multiple days to book an appointment for her father. She left multiple messages and nobody had called her back. The patient had been coming to this practice for years, but after being ignored so many times, they just gave up and decided to go somewhere else. The dentist didn't even know this was happening until we brought it to his attention. When the dentist asked the staff, they acted completely shocked. They said, well, we never got the voicemail. There must have been a glitch with the phone system. But then when the dentist checked the phones, the patient's voicemails were sitting right there. Then all of a sudden the story changed and they said, oh, right, I remember now. No, I thought the other receptionist had already called them back. That's why I didn't call. But then the dentist spoke to the other receptionist and guess what she said? Oh, well, I thought the first receptionist had already called them back. Now, this kind of thing happens all the time in dental practices, and it leaves patients with a bad taste in their mouth. Sometimes this is because receptionists just don't care, but oftentimes it's because they're just busy and forgot. And it happens all the time because there's no system in place. There's no accountability. No one verifies that things are actually getting done. And without that sort of accountability, people will keep dropping the ball and patients will keep slipping through the cracks. Let's look at another real example. This is a call recording from a patient who had been going to the same dental practice for a few years. She was in severe pain, feeling nauseous, even throwing up, and she suspected that she might have an infection. Listen closely to how the receptionist handled the call. Pay attention to her tone, her attitude, and the advice that she gave the patient. And ask yourself, if you were in this patient's shoes, how would you feel? Would you continue coming back to this practice?
Thank you for calling. Speaking.
Hi, I'd like to know if you have anything available for me to come in today on an emergency. I believe something's wrong with my teeth really bad, both top and bottom. I think I have an infection because I'm throwing up. My ears are bothering me on my left side.
The only day I have is Wednesday.
What am I going to do for pain then? If I have an infection?
honestly, you can take Advil or whatever works for you for pain until today, because I'm fully booked today.
Okay, thanks.
This is the kind of interaction that doesn't just cost you one appointment, it sends patients away for good, and it destroys your reputation. And most dentists never even know what's happening. When we played this call to the dentist, he was completely horrified. Now, if you think what I'm sharing here are rare, 1 in 1,000 calls kind of situations, something that could never happen at your dental office, then take a look at the kinds of emails we get back from dentists all the time who initially think everything is great at the front desk, and look at what they have to say after we start tracking their calls and appointment requests, and we show them how their patients are actually being treated. Here's what one dentist wrote after hearing just a few call recordings. "Oh my God, this is not the way I want my business handled. Thank you for bringing this to my attention. I will address this ASAP." Another said, "I'm absolutely appalled by this. I can't believe this is my staff. I have so many questions." If you're serious about delivering amazing customer service, the kind that keeps patients loyal and coming back for life, then you need an accountability system in place. You need a way to verify that patients are actually being treated like gold, not just hoping that they are. Think about when you call a big company and you hear,
"This call is recorded for quality and training purposes."
They don't just say that for fun, they actually do it. That's how many became big companies. They realize that keeping a customer loyal costs a fraction of what it costs to attract a new one. This is exactly what we do at RevUp Dental. Our software tracks every call and appointment request coming into your practice. It analyzes how your staff handle them, what they're doing well, and where they're losing patients, and what they can do to improve. We review hundreds of thousands of patient calls every month, and we analyze the performance of hundreds of practices and thousands of receptionists. We benchmark your team against other practices and show your staff exactly what the top performing offices are doing differently, how they book more new patients, how they deliver a better experience, and how to keep those patients coming back year after year. We train your team on how to reach that elite level and transform your practice into the one that patients rave about to their friends and family. If you want a taste of this training, I've put a link down below in the description for a free guide on how your staff can better handle some of the most common questions they'll get, usually around insurance. You'll also find more free guides and resources on our website by going to revupdental.com. Or check out our reviews and testimonial videos from dentists just like you and what they have to say from working with us. Thanks for watching, and I'll see you on the next video.